Cool. Let's get started. How's everyone doing?
Good. Thank you.
Good. First of all, I want to take the time to thank everyone for joining us today. We have folks that are still trickling into the webinar, so thank you very much for joining us again this week, this is our webinar number 15 since the whole COVID-19 had started. So I'm very grateful that you're taking time out of your afternoon to join us to hear the subject matter experts that we have on today, because I know that they have some great information, some very important information that we all should know, since today is the phase 3 reopening of the city of Chicago, and for the state of Illinois, I believe it was on the 30th, so May 30th. So they've already got a lot of the other municipalities, cities, and towns have already got a head start on the city of Chicago, but today's our day. And that also means that some folks also started going back to work today. So so this is, I think, a topic that was that's very vital to talk about today, because going forward, for some of us, we might have the luxury of working from home, but for many of us, we are going to eventually have to go back to our workplace, to our offices, to where we conduct business, and going to our customers. And then this presents a whole different world, right, that we're not used to, because now we have something out there that can catch us and really put us out for a while. So and in some cases it has some severe consequences. So I'm glad that you're joining us today. As always, I have some opening remarks, and I want to take some time to say them, and then we'll start by introducing the discussion panelists and go into the questions. So to start, the COVID-19 pandemic has significantly altered the global workplace and employer-employee relations. With the easing of restrictions happening while the coronavirus is still a high threat, it is important for employers to think carefully about formulating plans for resuming on-site operations in a safe and compliant manner, while also focusing on achieving business goals. As employers bring back workers from layoffs and work from home arrangements, they need to consider the size and layout of their facilities, the level of interaction of employees and customers, and also the safety issues and laws. I want to thank today's panelists, as they represent a distinct set of values and insight that make them subject matter experts in their respective fields, and having taken precious time of their busy day to share their insights on the new normal of work, and specifically returning to conducting business not as usual. Dear attendees, let's begin our webinar by meeting our featured guest. First off, I want to introduce Alberto Ortega. Alberto is the Director of Workforce Strategy and Business Engagement for the City of Chicago. Alberto, welcome.
Thank you. Thank you, Alfonso.
Next, sure thing. Next is Dr. Karen Mancera-Cuevas. She is the Public Health Director for the Illinois Department of Public Health.
Thank you.
Next is Pedro Cervantes, who is an attorney and partner at Tristan and Cervantes law firm.
Thank you.
And we also have Ricardo Regalado, who is the founder of Rozalado Services.
Thanks, Alfonso. I said it.
Of course.
Right.
Thank you for joining us. We have a lot of questions, and I know I said I'm going to pick through all of them, but let's start out with the most essential one, so that everyone gets a feeling for what your functions are and what you do. So whoever wants to answer this first, what do you do, and what is the primary function of your position?
So I can start off. My primary function is I am Deputy Director of Health Promotion at the Illinois Department of Public Health. So we oversee a lot of chronic disease programs, anything to do with the oral health guidance that you saw for dentists that came out of our office as well. We also do vision and hearing screening in schools, and all newborns that are screened in the state of Illinois also come through our office.
Great. Pedro.
Pedro Cervantes, as Alfonso said, I'm an attorney. I'm a partner at Tristan and Cervantes. I've been here 14 years. Sort of the tagline and what we do is we provide legal solutions for business, government, and non-for-profit organizations. And within the practice areas that we have, one is labor and employment, which is, I believe, relevant to some of the conversation today.
Absolutely. And Ricardo?
Alfonso, thanks for having me again. So yeah, we own a company called Rozalado Services, and what we do is we are a single source solution for facility service needs. So anywhere from the day-to-day commercial cleaning task, which is obviously, like we said, very important in this day and age right now with everything that's going on, and we take it all the way to electrical, plumbing, supply order management, PPE management. So we really try to be the one single source solution for clients to allow them to focus on their business at hand. Let us focus on the facilities.
Great. Thank you so much, Ricardo. And Alberto.
Thank you. First, let me start off by saying that we'd be remiss if we didn't acknowledge the fact that the city, the neighborhoods of Chicago are undergoing a good amount of stress in relation to what happened to George Floyd. So I want us to acknowledge and be in solidarity with our Black and Brown sisters in this current point in time in our history. In terms of my role, workforce, Director of Workforce Strategy Business Engagement, I'm charged with working with workforce development organizations, city colleges, CPS, DFSS, the Chicago Cook Workforce Partnership, in an attempt to align our systems, coordinate our efforts, and help people get jobs and help employers find people.
Great. Thank you so much, Alberto. Let's start off by asking the question, which employees should return to work first? Alberto, since you have the stage.
Sure. There's actually a good list here that I have. And I'll go through some of them, but within phase 3, the following industries are opening first with specific guidelines. You could go to chicago.gov/reopening. So the businesses that are looking to reopen with phase 3 include childcare centers and family childcare, non-lakefront parks, right? No contact sports, libraries and other city services, office space jobs, professional services, real estate services, hotels, lodging, outdoor attractions, boating, not including that playpen, non-lakefront golf courses, non-essential retail, personal services, hair, nail salons, restaurants and coffee shops, outdoor dining only, manufacturing, construction and warehousing, hospitals, dentists, community mental health centers, federally qualified health centers, community health centers, public transit, regional transit, taxis, and rideshare, and gyms, outdoor and one-on-one personal training only.
Great. Doctor, which employees should be the first ones to return to work?
So it really depends on industry. So there are some industries that have more pivotal workers for significant roles. There are some industries that have more of the supervisors that come in first as the front line. And in other industries, you might have more of those, frontline employees, frontline workers. So it really depends on where and which industry that you're talking about. Obviously, there's a lot of phasing in. And with that comes a lot of social distancing, the ability to be able to do that within the workspace. So those should be considerations as well.
Yeah, and I ask because for some companies, essential workers might be different than for another industry, right? Yes. But I've been looking at some of the, from some of the companies and some of the corporations, their return to work plans, and some of them are very intricate. And I'm like, wow, this definitely didn't take like a week to do. It's something that they've been planning and gearing up for like you said, having managers and supervisors to welcome the workforce back to the office.
Mm-hmm. So that's why I say that it's really, really dependent on industry. Let's say, for example, nail salons that you've seen that have just opened. You might have a lot of staff that now have to, spread out clients. They may have people who do hair, nails, those types of things. So that's an example as to how they may have to reprogram how they previously did. They may not be able to book as many clients. They may have to sanitize all of their combs or their hairbrushes. So it really depends where we are. And previously indicated you're hearing and was just listed by the other panel member, the different sectors that are opening. So that's really in the first phase. And, you know, as employers are getting employees on board, then they're really being able to develop more comprehensive plans.
And that's just you know, private businesses, right? Because there's also, I mean, there's offices that are opening again, and I mean, and folks are being on board, being brought back.
Mm-hmm. Yes, and it's in a variety of different sectors, and obviously the individuals who work more in, you know, manufacturing are in a different type of space. You know, at the public health department has worked with many different businesses and industries to be able to provide guidance. Much of our guidance is actually provided online through the Illinois Department of Public Health and through the CDC in terms of, you know, like sanitization, having the Clorox wipes on hand, having masks, having social distancing. So a lot of those things also need to be considered for an employer before they're also considering what type of employee I want to bring in, but also keeping the employee safe and keeping those considerations in mind.
Thank you, Doctor. Ricardo.
Yeah, I mean, we've been in a unique situation ourselves because we've been considered an essential service from day one, and like we talked about, you know, before we got on, Alfonso, too, is we've lost and paused some accounts due to, like, hospitality is a big niche for us, so they've closed, right? So those teams have been displaced and put somewhere else. But literally since day one of everything that's been going on, our employees have not stopped working. Healthcare is a big one for us, where they're open, so we're there, right? So what we've seen though is our office, right? Right now in my office, I've only had like 3 or 4 people here, so it's actually the management team. Core management of our company are the ones working remote, and the field teams are the ones in the field right now. But now with, our June 8th for us is the day our HR said, hey, let's start bringing everybody back. But it's weird, right? We get a vibe of, we have different divisions in the company that have been given a spreadsheet and said, hey, Monday, Wednesday, Friday, you're on. Tuesday, Thursday, Saturday, you're on. And like, we're a big company on culture. We're all about empowering ourselves in this, small family community that we have. And it's going to be a little weird to see some people come back and, you're not working on the same day they're working. But as far as the field teams, cleaning is the most crucial thing. So we've now become more embedded with our clientele now. And I mean, we're shoulder to shoulder with them. We're helping them create coming back to work plans. That's why I've been actually, this is like my 3rd webinar talking about what you should do. Doctor talked about PPE. Who would ever thought we'd have been having so many discussions about PPE with clients? Hospitality, you're going to go in a restaurant and they're going to have a mask on. It's very unique.
Yeah, and you touched on something, which I think is very important, is the culture of a company, right? I think this is definitely gonna reshape what a company culture is, right? Because especially if it's a minority-owned business, and specifically Latinos, we're big huggers. Oh, handshake, seals the deal. Those kind of things, we won't be able to do that for the foreseeable future. Just for safety reasons, and so those elements of what fortifies the relationships that we have with our customers and other employees, we're gonna have to skip them for now and see when we're able to do that again without and let it be something that's natural, right? And without fearing that we're gonna catch from someone who wasn't intentionally wanting to do you harm, but it happens. Mm-hmm. Yeah. So Pedro.
Just I guess addressing your question on what employees should come back first. I mean, building off what Alberto said, obviously you want to follow those guidelines and make sure that the industry, then the sector that you're in, is one of the sectors that is allowed to reopen. And then also, obviously, if you are allowed to reopen, then I know there's general guidance, and in particular in offices, I know the recommendation / rule is that the the number of people be limited to 25% of your capacity for the office, and obviously then dealing with all the social distancing rules and recommendations as well. And then I guess from more of a legal perspective, obviously to make sure when you're bringing people back, regardless of what position they're in, that it's not on a discriminatory basis. So you're obviously not making a conscious decision to only bring men back or only bring women back or only people of a certain culture, things like that. So that's the legal aspect of it, I guess.
And all different items that, you know, psychologically an employee can kind of can read into it and say, hey, well, you know, how come they have to go back first, and so maybe that's something too that when it comes to the legal aspect is reviewing the policies that are in place now. I think that's also and having to adapt and modify them so that they are inclusive, and hey, you know what, and so the employees understand that it's a question of we need you for the functioning of the functioning of the business, and not necessarily because of you're different than the rest of the than the difference you're different than the rest of the workforce.
Good point.
So next I want to ask, how should employers go about implementing social distancing protocols for employees and customers? This was a question that I thought about because where I live, and I live in a predominantly area where highly educated individuals, they don't wear PPE. They don't wear any mask when they go out. They don't wear any mask when they go out running. No gloves, no concern. For other folks that are sharing the sidewalk with them. So that's an important question for me. Is like if you can't get them to do it when they're doing something, that's for their health, right? How are you going to get them to do it when they're being asked to return to work? Whoever wants to.
Yeah, I mean, I think it comes down to just, I guess, creating protocols, right? Like, because Alfonso, I agree. I see it all the time. People aren't wearing masks, but again, it's everybody's entitled to just follow, I guess, their own personal protocol. But for us, we actually just talked about this. So we're in the middle of trying to hire about 100 new employees in the next 30 days. So our ads are out. We're getting phone calls. We're getting people to start coming in. So we're actually going to lock the front door and then open up the garage side door, have 2 table setups, and then have some markers there, depending on the weather being nice, right? And just have people lining up there, coming in, filling out the application, having a little side table to talk about it with some distance between each other. Like I said, we're doing the spreadsheet of divisions. So then you come in certain groups, 8 to 10 employees at a time, putting a plexiglass right at the front reception desk. So if she is having to speak to somebody, because we get a lot of deliveries. So we've got FedEx, UPS coming every single day with deliveries. They do their part. They knock on the door, leave the delivery there. But if it's a big pallet, we have to make contact. We have to interact. So it's really just setting up good stuff, in the kitchen, in the community area. Take away a lot of chairs, keep it minimal. Our front desk reception manager is going to make the coffee for everybody. So then you're not going there to touch the coffee. Everybody's touching the coffee and touching the refrigerator. We're keeping things limited. And it's crazy because we're a cleaning company, so we're sanitizing, spraying our place all day, every day. But again, it can get contaminated the next day if somebody comes in with, feeling ill.
Sure.
I'll just add to that. Great points raised by Ricardo. In terms of an office setting, it's critical to have hand sanitizer dispensers distributed strategically throughout your office location, within your office, in terms of the lobby, the entering upon that office, having bathrooms be accessible so people can wash their hands. Alfonso, you mentioned joggers. In terms of the industry guidelines for parks and recreation, there should always be 6 feet between people. So that includes runners, joggers, bikers, walkers. Outdoor sports should be limited to non-contact sports, in small groups only, of course. So like tennis would be an example. I don't play tennis, but could be a good opportunity to learn how to play tennis. Playgrounds are definitely temporarily closed, given that we have a lot of contact there. We want to minimize the spread of potentially COVID. And then social groups maintaining physical distancing in open spaces, and then PPE, wearing face masks, ensuring that you protect yourself and protect others.
Doctor.
Mhm. Well, I mean, definitely, there has to be, like in terms of social distancing to have, as indicated, to have the 6 feet and really have that. But I think in addition to that, really is being able to like also mitigate, like social space and, like I think part of the challenge too is that sometimes in work environments, you see sometimes the congregation of individuals where geographically, because of the layout of the workspace, it's hard to maintain that 6 feet. So I think that also it's another issue of timing where, you time when individuals are going to be coming into the building so that there's not like if they're expected to come in at 8:30, you can't have a ton of people at the entrance. So maybe, have a little bit more, like maybe every 5 minutes someone's going to come in through the door, have that type of thing as well, because those are other considerations that need to be, considered in terms of like the geography and layout of each company. It's going to be very different.
Yeah, I saw, I saw an expert, a CDC expert, say that folks should bring their own lunch from home for now. So then maybe also setting up different lunch times for folks, right? That, hey, if you're gonna be in the kitchen area, you're gonna be, you got your hour, and then have a couple of other people go on in a different hour, right? So it's adjusting.
It's the same thing also with restrooms, that also sometimes people go around lunchtime. You may need to want to, if there's a company restroom, have, like slated times when people can come in and out, because that's also an area of congregation where, potentially it is hard not to run into the other person, not be 6 feet apart.
How would that play out for folks who are smokers?
Mm-hmm.
Because they're going in and out of a building, and and this might play in a little bit into Pedro's field, in the sense of you don't want them to feel discriminated, and
Yes.
they feel they need to go out and smoke, but at the same time, I mean, think about all those points of contact that you are experiencing, more than the folks that are just sitting down, in their cubicle, but you're routinely going in and out. So how does that happen?
Well, I think that that's really more working with the employer, maybe finding scheduled times that might be mutually convenient while not infringing on the rights of the individual, but also, in the spirit of public health, not, purposely maybe exposing another employee that might be in the vicinity. So those are really going to be employer-based conversations and really understanding, like what is the lay of the land in each one of the work environments to be able to make a safe environment for all employees.
Right. Because I mean, we all know that there's that one coworker, he's hard headed or whatever, and maybe someone that's just I'm like, I'll do things my way, I won't do things as I'm told. So yeah, it's maybe finding a way that, hey, this is the way it's got to be now, right?
Yes.
Pedro.
Yeah, no, just to build off of that, obviously, I'll kind of parse out on that sample of a smoker. Smokers aren't as much as some might want to be. They're not a protected class, just being a smoker. But obviously, just a general law lesson is obviously protected classes are such things as like race, gender, national origin, language, things like that are in what's called Title VII, or the federal law of Title VII. So as long as you are setting the rules, let's say, for example, for the smokers, the same across the board, regardless of the type of person or background, then that's okay. And then as far as like just generally, obviously follow the guidelines with the social distancing. And then again, with masks and requiring hand sanitizer, all that, again, I think the emphasis from an employer side and maybe from an employee side is looking at is that there should not be a discriminatory treatment. So if you're making everyone wear a mask, everybody has to wear a mask. It can't be all the guys have to and all the ladies don't have to. Things like that, that would be potentially discriminatory. But then also it kind of brings in the issues of American Disability Act, which there's going to be a lot of unique situations, because let's say somebody has a skin condition that they can't wear a mask, or they have breathing problems, they can't wear a mask. Technically, you're supposed to allow for reasonable accommodation in that situation. What that would be, it depends on a case-by-case basis. Maybe it's putting that person in having that person have a separate room, things like that. But again, it'd be a case-by-case basis. So it's going to bring up a lot of unique legal issues that will have to be dealt with.
Yeah, and then, you know, and then having a return to work plan. I mean, that's something that you're going to have to go over, you know, bullet point by bullet point, and figure out all the scenarios that could possibly arise, right? So, and making sure that you address each scenario. So knowing who your workforce is, so that way it doesn't catch them by surprise that, oh, I didn't know that, now I have to do this. And obviously, in the spirit of cooperation, that we hope that everyone is understanding, right, of what's being asked for us for the foreseeable future, so that we can all have a harmonious work environment, but also at the same time, so that our customers feel safe and they feel protected, and they feel that they can you know, they can come to our place of business, and it's something that they don't have to fear.
Absolutely.
Next, I want to ask, at a minimum, for the safety of employees and customers, what personal protective equipment, PPE, should be provided by business owners?
I mean, I think,
Ricardo?
yeah, so we're, I think, again, in a unique situation where we have it at the front door, right? We have mask, gloves, eyewear, shoe covers, because I've been very proud of, you know, a lot of our employees. I'm probably about 82% Latino based employees. They're all wearing PPE. You know, they walk in covered. They walk out ready to go. But we actually have it ready for all of our employees. You know, whether, you know, I have the facility services company, I have a software company underneath the same roof. So, you know, I have a lot of developers and engineers that they're used to now seeing PPE. So we actually give all of our employees PPE at the front door if they need it, or else they come with it on their.
Ricardo, does it become normal? I mean, after a while, since you do work with, you know, with industrial cleaning, and so, you know, just because of OSHA requirements and all kinds of different laws and you know, and procedures that we need to follow, that maybe perhaps, you know, the folks that work in your industry, you know, it's commonplace for them.
No, it is. It truly is. I mean, we also provide a lot of the special disinfection services where, you know, we've treated over 35 COVID confirmed case environments. You know, manufacturing is a big one. Healthcare, senior care centers are big. So the teams know what a coverall suit, Tyvek suit is. A lot of the employees know what a P100 respirator is, you know, because they want to be safe. You know, and if we're treating a lot of environments now, if it's high risk, they're wearing the, you know, top to bottom PPE, where you don't always have to, you know, if you're in the workplace environment, but as more confirmed cases come out, you're almost considering every area medium to high risk at some point. So you might as well, you know, be familiar and educated with the PPE.
Awesome.
I could just jump in here. I just want to commend Ricardo. I don't know you, but I'm glad we met through this platform. Commend you for ensuring worker safety and providing worker protection, because if you think about it, you know, we're all reopening in time and phases, but when you protect your workers, you instill confidence in them, right? You're in essence investing in them, and also investing in growing the confidence in the community for them to come out and patronize your business. So you're a good employer. I want to highlight that. And on the note of PPE, the city of Chicago's personal PPE market is something that we can all access if you're a small business, a community-based organization, or a nonprofit. And it's a way to secure affordable supplies from verified sources. And you can access that PPE market versus via, ChicagoPPEmarket.com. That's ChicagoPPEmarket.com. Thank you, Ricardo.
Oh, thank you, sir.
Alberto, and the people that you can find on the market, are these companies that are like city certified? They pass some
information on that, but I can verify in time. I'm going to presume that they are, because
Okay.
it's run through BACP, and that department actually runs the PPE market exchange, and they work to ensure MBE, WBE participation.
Great. Fine folks at BACP, definitely. Karen?
So definitely, like PPE is, as indicated, required. And really we want to encourage, based on industry, to have specific PPE. So some industries are going to need like those N95s. Others are going to need just, the protective masks. Some people are going to have, like the actual face shields. Like for example, as I said, out of our office, we provided dental guidance. So dentists need to be suited up, need to have gowns, need to have the gloves, need to have the face shield, need to have the goggles because they're working with aerosolization. And so they look much more, in a lot of ways, covered because of the type of work that they're doing versus someone who may be doing an office job that may need to come into that environment with a mask, may need to adhere to social distancing, may need to have the hand sanitizer, may need to have the Clorox wipes. And so it's a very different type of disease mitigation because they're working in a very different type of work environment. So it's really going to be very work environment specific, and really the employer should be following guidance that both the state of Illinois is providing and also the Illinois Department of Public Health to then craft those types of measures accordingly.
Yeah, and kind of back to what you said is that it's different for different employers and different work places.
Mm-hmm.
Pedro.
Yeah, no, I don't think I need to add too much to that other than what I think the doctor made the good points there on what, following the guidance that's set forth in different areas or different types of work. The other thing just to think about, especially in the sort of the big building, downtown type office buildings, your office buildings may have different requirements than you have in your specific internal office space. So I think it's good to make sure your employees know what those requirements are. If you're an employee, to make sure you know what the requirements are of the actual building itself versus your own individual space. So that's the only thought I think I would add.
From a legal perspective, is there a minimum requirement that just so that you're from a liability perspective you're protected, or right now is it just follow the CDC guidelines, follow the guidelines for the state and for your local municipalities, and since this is fairly all new to us, right? So or do you feel that there's
as far as rules or guidelines, yeah, I would say that as far as I know right now, that those are the guidelines that you have to follow. If you don't follow the guidelines, obviously, as an employer, you may be exposing yourself to risk. Not so much as to employees. I mean, you might have workers' comp cases and everything, but obviously with customers or visitors, you may be exposing yourself to a liability claim for personal injury, although it'll be unique to determine how they can establish causation. But I guess that'll be what the lawyers are going to fight about. But yeah, just as a lawyer, I'd recommend following the guidelines to limit your liability. It may not prevent a lawsuit, but at least it'll give you a good defense.
Right. And because you're also put in that situation where maybe that person already had it before they even arrived to your doorstep. But you don't want to be put in a situation where, okay, well, now let's litigate and let's find out exactly how it happened, right? Because it's not good for the business, and also it doesn't do good for the reputation of the company, right? That finds themselves in that particular situation. But yeah, I think definitely it's following the guidance that are already set in place. That I think it's a good checklist of things that should be of things that should be followed and steps that should be followed.
And Alfonso, just to add to that, there's at least for those businesses that operate within the city of Chicago proper, again, you can go to the chicago.gov website and review the industry guidelines specific to the industry that you operate within, and then prepare your own opening plan, and then take a survey administered by the city of Chicago. And so that survey is going to help you, if you think about it. Maybe we could debate the legality about this later, Pedro, but it's just another way that you can create a plan that's on paper and then take a survey through the city of Chicago to then self-certify that you actually took measures to ensure, social distancing, PPE, etc., so that in the event there's any question, you can check that box.
I want to ask Alberto, Pedro, Karen as well. I mean, Alfonso, quick question is, what about, because I don't exactly know how the CDC lays this out, but what about having the employees tested as far as, so we partnered with a COVID-19 testing facility. So I've had 6 employees go get tested because they were exposed. What about, for the company wide as we reopen? What Pedro, is there anything that do we require? Are you supposed to require? If you're a 50+ employee size office, can you recommend to go get tested before you step into the office, or how does that work?
Yeah, I mean, generally, I don't think there's a requirement that you test right now, like under any law or guideline, but you can test. But again, the key is you don't test discriminatorily. So it has to be everybody if you're going to test, like before they come in. As far as current, so there's 2 different standards. Two different possibilities or situations. One is current employees. Another is potential employees as you're hiring people or looking to be hired. So as to current employees, again, testing, whether it's for the actual, the physical test or actual like temperature testing, things like that. You can do that, but again, it has to be applied across the board. Then as far as new employees, potential employees, the key is that there has to be there has to be an offer pending, and that test has to be contingent. So that test has to be the contingency. So you can't test as a threshold question to even make the offer. There has to be an offer first, and then with that testing or the results of that testing being the only condition for being able to start as an example.
So this would be similar to like a drug screening.
Correct, or a background check, things like that.
Got it. Karen?
I believe that that is correct, but I believe that there is a differentiation for healthcare settings, just because you are working with patients. So if you suspect that you may have COVID, you should then, have access to the test. So as I said, some of these measures in a regular work environment, you should not be requiring individuals, to have a COVID test unless that is part of your legal procedure as a company. But then within the healthcare settings, those are a little bit different because you're working with patients and you don't want to expose those individuals to potentially COVID. So those are considerations to take into mind.
Right. And then kind of to what Ricardo said is that, bringing in a third party, you could, that potential, if you are, considering to hire someone, they could say, well, what do they know? It's one of those things where it's really, it's something that's foreign to us, right? Maybe not so much in other countries where viruses and things like that spread, or it might be commonplace or maybe even part of the, before receiving an offer, right? Because employment laws are different in different countries. But yeah, definitely, it's something that I think we should all be understanding of it, and maybe we're being put in these situations. There's going to have to be a little give and take, right? So that the end outcome benefits that one person that's looking for perhaps employment, but also for the employer that needs that employee to do, to fill a critical role within their company.
Mm-hmm. Yeah.
And the other thing to add that's unique to these times in this situation is, as far as both from the employer side, but also as an employee side, as far as in rights, is that, I've heard that some companies are, for example, requiring their employees to go online and do like a self-evaluation test. Like, I don't have a fever, I don't have cough, I don't feel stuffy. And then they have to literally bring a sheet with them that shows that they did that test. And then obviously, or temperature testing at the door or beforehand. I guess the point I'm getting to is that legally you have to pay an employee for that time. So that could be an expense for employers. And obviously employees would have the right to be paid if, for example, you're waiting, you have to get to work 15 minutes early because there's a line, because everybody has to get their temperature checked. Technically, you're supposed to be paid for that time legally. So and on the employer side, be aware of that, or else you can subject yourself to lawsuits and wage and hour claims.
Pedro, from what you know, and as of right now, can employers do that? Check employees' temperatures before they come into the workplace?
My understanding is yes, while this state of emergency is pending, for sure. If the state of emergency ends, obviously the circumstances may change. But it is allowed at this time based on the current state of emergency, as long as it's, again, not applied discriminatory. And if you're requiring people to get there early, et cetera, you have to compensate them for their time.
Great, thank you so much. That was a really good question, Ricardo, and definitely one that needs to be addressed. Next, should employers resume in-person employee meetings? Now that you have them back, in an office setting, what would be, Ricardo, what do you think would be safe when it comes to being in a meeting environment? Or maybe does everyone just take the meeting from their cubicle and they're doing it just kind of how we're in Zoom right now?
Well, I got to say that I was never, even though I do have a technology company too, so I know how those, those guys, they can work remotely. It's possible. I've never been a work from home person. So whenever I saw this happening, I was like, wait a minute, how do I know they're working? What do you mean they're, work from home was never nothing that I was acceptance of. But I got to say, performance has been through the roof. People are accountable. People are working. We've got technology like this that we're on right now, where we should just take advantage of as much as we can of these type of digital, video conferencing tools, because it works. If you come to a conference call like this with an agenda and you complete, all of your to-dos, you almost don't waste more, you waste more time probably in person. So are you going to have it? Yes, it's okay to have it, right? I mean, I say wear a mask and keep distance, because, we built another conference room in the office during this downtime right now, just for that reason, because we only had one big conference room. But look at how good this is working for us right now. Zoom calls, Google Hangouts, these things are showing to be very valuable. So, I mean, you should definitely have this in your agenda now as a business employer to let people use these type of video conferencing tools.
Yeah, but eventually, and kind of how you said that you're also building on another conference room, that I think conference rooms are key. Whether we go back to normal or how long it takes, but sometimes you need to have those conversations where it's a closed door conversation, right? For the sake of the person that you have in that conversation with, that employee that you're having the conversation with, or it might be a customer, right? But there's a confidentiality that needs to be respected. So, from what we've seen, Zoom, is a great company. That's what I'm using here, and they're actually, like you said, it's turned out to be a great tool, and their stock price went up today. So, yeah. But
I'll tell you, so I do have, we're in healthcare a lot right here, right? We have a large client here in Chicago where, the cleaning focus too has changed, right? We call it processing now. So when we have a building, we process your building from a cleaning, disinfecting, back to cleaning process, where we've taken it a step further to educate our clients too, we can't be there 24/7. You don't have a budget to pay for a cleaning service 24/7. So we've taken what we've done, created videos, help clients understand, you clean first with a neutral cleaner, then you spray and wipe, then you clean with a disinfectant, allow dwell time, then you use rinse water to clean off. If you create a digital playbook for a lot of these environments, these office environments, healthcare, and any kind of an environment, they can start to do things themselves too. Because again, you can't be there 24/7. So if you have a meeting with Pedro in an office, you guys leave the office, you have the spray kit, you could spray the table, clean it, have it checked off, allow for the other person to come into the conference room, right? Because cleaning companies can't be there every minute of the day. So now is the time that everybody starts to learn and understand the difference between clean and disinfecting.
Yeah, and having all the scheduling apps and software that's out there, that it's even free. So there's no reason why yeah. Oh, there you go. Right. Definitely that we can utilize all these tools, right, to keep us safe, right? So it doesn't have to be as scary to be in these type of meetings. Alberto.
No comment. What was the question? I was listening.
About in-person meetings.
Yeah, no, I agree with Ricardo. Utilization of conference technologies like Zoom, Teams. If it hasn't been utilized before, it's ultra utilized now. There's an over reliance on it to increase efficiency. So people are actually working more as a result. But in terms of office meetings 6 feet apart, building that extra conference room makes sense. I think the new norm is virtual, right? You can host actually you could do more meetings virtual and incorporate more folks, more stakeholders than previously possible. So definitely accentuate all of the above.
But Alberto, in your role with the city of Chicago, I mean, there's meetings that you have to be there in person.
Yes, right? Yes, with when it requires decision makers to be in a room. But even now, I mean, I've been communicating with city colleges, folks at the partnership, PFSS, via Zoom, via Teams, unless it's folks in the mayor's office, right? We convene together, but even then, we host our calls. We could be in the office, offsite, whatnot. We utilize those technologies to stay connected. In addition, we message each other, email each other, we pick up the phone and call each other. So it's about increasing that connectivity.
Karen, any input? I mean, especially since I know you have a little bit more insight from the health perspective of it.
Yes. Well, I think that really what we want to encourage is ideally having more remote interaction versus in person. Obviously, there are some functions, sometimes because of a variety of reasons, that need to be done in person. And when we try to do in-person meetings, really the encouragement is to limit the quantity of people in the room. So let's say if it's just one other person, keeping the social distancing, having these conference rooms that, where people are spread out, if necessary, wearing masks in person, having the hand sanitizer on the table, having the Clorox wipes. All of those things are extra considerations to keep in mind if an in-person meeting is required. But obviously the convenience, as previously noted, of having the remote type of conversation, tapping into the technology that we have today is more ideal.
Great. Thank you so much, Karen. So next I want to ask, once the stay-at-home order has been lifted, what does an employer do if an employee refuses to come back to the office? Which I think it's a very legitimate question. I mean, there's people that are freaked out of their mind about this. So like I said in the beginning, it's business not as usual. So what could happen there? Pedro?
Well, I mean, again, that's a good question, but I think there's obviously fact specific. There could be a whole lot of unique circumstances. Obviously, if there's a person, like if you have employees that go out and service, let's say, customers on that you need them there, like in person and not electronically by Zoom, et cetera, then that may be a situation where if they refuse to return, you can legitimately fire them or lay them off, et cetera, versus the interesting situation will be, let's say someone does have an underlying health condition like diabetes or asthma or whatever, then this is a unique situation. I don't necessarily know the answer, but how does that interplay with the Americans with Disabilities Act if you're forcing someone to come back or not lose their job when they may be exposed to the virus and become ill? So yeah, that's a unique situation. So I think under circumstances, so that would be an exception to being able to require somebody. But do I know the outcome of that? I'm not sure. So, but I get, not to give the lawyer an answer, but it is a very case-by-case basis. If there's any specific examples, certainly I can address them. But I don't know if you have any thoughts on anyone on the panel has not thought of like a specific example that I can sort of give a better answer for.
Alberto?
Yeah, I was actually looking up a resource I'm going to share with you for you to post. It's FAQ. It's going to be a case-by-case basis, but in essence, there should be no discrimination for folks who feel they're at risk given a pre-existing health condition that may help or actually make them more susceptible to COVID. But there's definitely workplace and worker protections that the city of Chicago is going to be enforcing. So I have a FAQ. I'll send it to you as a PDF, so you can post and share with the those on the call.
Sure. You know what? If you can put it in the Q&A or in the chat,
okay,
so that way people can
I'll work on that.
Can access it. Karen?
Well, I think that, as previously mentioned, it is going to be case by case, and it's also going to be employer by employer. I mean, there may be certain restrictions based on job function that, let's say, like for more of a healthcare work environment, where they are considered, like essential. Their role is very specific. where employers could really be working through legal and their legal counsel to bring people back. Also, there are healthcare considerations where people may have pre-existing health conditions. But in each work environment, there are different human resource regulations, and those are really things that we need to keep in mind depending on individuals who may not want to return. So there may be individuals who may not feel that proper PPE is in place, that proper, sanitation is in place, and they may have a warranted issue in that case. And then there's other individuals who may have different particular type of circumstances that may make returning to work challenging. So I think that definitely it is something to consider.
But going back to what Pedro and Alberto said, that's more of a legitimate reason, right? In regards to for the reasons that they might have a pre-existing condition, or they're being discriminated for a disability act, a disability that's probably being discriminated against. But how about someone that just developed a phobia? I mean, some folks have not been back to the office in 2.5, some 3 months. I mean, it's very easy to develop a phobia in between that time, and especially, I mean, the news is nonstop. I mean, obviously, we've had some tragic, we've had some tragedy that has happened, all across this country that, for a lot, attention has been diverted from the importance of how important and how deadly this virus is, but that's still there.
I think that is still there, and those are considerations that should be in place. But again, one needs to work with the employer, because does the individual need to have certification? Do you need to have an evaluation from a psychologist? Does there need to be something which, can certify or substantiate the condition to satisfy the needs of the employer? So each, human resource or legal entity is going to have to be able to deal with that accordingly, and then be able to really provide guidelines. But again, this is very much an evolving process. So I think that this is really going to be new territory for a lot of people who are working in human resources to be able to really establish some guidelines or parameters.
Thank you, Karen.
And just to add to that,
go ahead.
Sorry, just real quick, just to build off of that, like one sort of practical consideration that may not have to do with health. I know that probably people have heard about it, but there are potentially employees that, for example, may not want to return because they're making more money from unemployment than when they worked. What I understand legally, that is not a basis not to return, but that is a possibility that employers will have to deal with that based on, at least until the end of the federal additional compensation that's being paid by the federal government that runs out. But for right now, it may be a legitimate issue that employers have to deal with, but that would not be a valid basis not to return.
Right, and at least with that situation, that probably has more legs when it comes to a potential reason to fire someone.
Correct.
Because there is that, it's not because of your health, and it's not because you can't do the job anymore. It's more because you're trying to take advantage of a situation, right? So I think even if this is something that does go to court, could it be something that could it be considered that, hey, this person is really they're suing for they're suing for the wrong reason.
Yeah, and that's where it gets complicated. Is someone, and again, they may or may not have that as a basis for not wanting to go back, but they could also have that as a basis, but say that they're fearful or that they're sick, things like that. So that's going to be the interesting challenge.
Sure. Ricardo, I know you have a big staff. And then, like you said, you have office workers that will be coming on board. I think you said on the 8th.
Yeah.
So yeah, what happens? What happens when I know you're a cool guy and you want to be empathetic. Obviously, that's the one thing that we can't forget, right? We have to have empathy and be understanding of. I get freaked out. I was at Jewel yesterday, and it's like, hey man, but not necessarily telling them. It's like giving them the evil eye, right? Stay 6 feet away from me. So it's one of those things that we have to have empathy for, because this pandemic does affect people differently. There's some folks that, because they're younger, they feel more emboldened. It's not going to catch me. But then again, you might have, you know, a workforce that might be a little bit up there when it comes to age, and then you don't want to get into age discrimination either, but they might have, their concerns are legitimate in regards to going back to work, and it's like, am I going to be safe there?
Yeah, I mean, I'm a very empathetic guy. I am the super nice guy here. That's why I don't make some of these hard decisions now. I have a lot of people that make those for me. But I have a big family business too, right? So we're in 12 states. You know, we have accounts in Philadelphia, Rhode Island, the East Coast over there, where it's, you know, it's bad over there. But I have been very, blown away by how I have not had one team member or employee that has refused to go back to work. And you're talking about these people are going into, you know, areas that had a confirmed case, right? They're in environments that could be scary to many. They were scared in the beginning, but like, you know, Alberto touched on before, is we made it our initiative to give them the PPE they needed. We did training videos. We started doing training videos right now. It's all about, if you give them a safe environment, I feel a lot of people they're going to see now the recognition from their employers more than ever. So if you recognize the safety and show that you care, I mean, you'd be surprised how many employees, and I've heard stories that, yeah, some people are, like Pedro said, are taking advantage of this, and that's unfair. That sucks, to be honest, that you would want to sit home and not actually go out and work. Guess what? Take advantage of the people that are looking for work. And every day, I just had 6 people walk in today looking for work.
Although, and also taking advantage of the employer's, you know, insurance that, you know, they're using it for the wrong reason, right? In regards to it's there for it, you know, something catastrophic happen, which it has, but then it's like the wrong reason, you know, comes into play when it's like, well, you know, I'm making more money now by not going to work than actually doing the duties that were you know, that I got hired to do.
Yeah.
Haven't taken into account that my employer has taken all these steps to take into consideration my safety and my health.
Yeah, and it's big on, I mean, we use Slack a lot, right? So we do a lot of company updates, company-wide.
Sure.
So it's helped out too to identify those that have, you know, illnesses, you know, diabetes, that have, you know, respiratory issues. When you call that out in a group gathering or in a company-wide message to say, hey, you know what, I know you have, you know, a pre-existing condition. Hey, just stay home, you know, work the next 4 weeks, take care, you know, let's get the rest of the office going. Those are the kind of decisions that by us making them ahead of time, it pays off tenfold. Because now it just gives off that vibe again that, you know, your employer cares.
Sure.
The extra mile.
Yeah.
That's it, man. That's the biggest point that you got to do.
Yeah, and if it's only fear, and not that fear is a little thing, right? But I think that also might calm the fear of someone that, like, hey, you know what, you know, my employer really does care about my pre-existing health condition, right? Which gives me the fear to go into the workplace. But at the same time, I feel a little bit better that, hey, if he's putting in this effort and he's allowing me to, hey, take another month to work from home, maybe it is time for me to go back in, and things are going to be okay.
I just wanted to lift a question put in the chat by Ricardo Sequeira. He asked a question in terms of the cost of PPE, right? The COVID testing, that's all going to raise the cost of doing business. And I'm glad Ricardo touched on this a couple of times, but never in the history of, you know, workers or the U.S., for that matter, has the health of a worker been so important, not only for the productivity, but for the public. So the more that employers do to protect their workers in the work environment, the workplace, the better it's going to be for business, for productivity. So, you know, how you factor the cost, right? The rise in cost is entirely up to you. But one thing is for sure, the better you communicate that, the better you market that as a differentiator, as a plus, not a takeaway. Oh my God, this is bad for business. It's going to cost money. Yes. But the more you can communicate that to the public, it's going to actually increase business because you're protecting your workers, you're protecting the public.
Yeah.
Yeah, and it might be something that, you know, using social media, using all these avenues that we have now to communicate, where you let your customers know, it's like, hey, you know what, we do our best to have, you know, PPE here, you know, at all times, but just in case, bring your own. You know, we welcome you and whatever, but you know, there just might be the situation where you run out. You know, and again, it's not every not every company is a corporation where you have an account with a Granger or with the supply company that can supply you. They can look into your inventory and your levels of inventory and just like Ricardo said, that the UPS and the FedEx trucks come in and out all the time, and they're supplying you with product. But at the same time, I know that there's people that want to go back and want to go back to those small businesses and give them business, and so hopefully there's this this medium, right, where there's this place where both can meet, where everyone feels safe, and at the same time we're doing good for small businesses and also big businesses, right? We need them because they're our customers.